Hey guys, welcome back to my TikTok. If you haven't watched my TikToks already, go ahead and hit that follow button. I'm going to explain to you what the patient-physician relationship is. Imagine you're sitting in a doctor's office, right? The doctor knows a lot about medicine, a lot about treatments, and a lot about what to do based on what you have. But you know a lot about your life, so who gets to make the decision for treatments based on what they know? There are 4 models for a patient-physician relationship. Today we're just going to be focusing on 2. So we're going to look into what the paternalistic model is and what the deliberative model is. And y'all can tell me which one y'all prefer in the comments. The paternalistic model is basically the doctor knows what's best. If you think of the movie Rapunzel, the mother keeps saying mother knows best because she keeps doing things for her daughter that she doesn't like, but she knows what's best, so she's just going to listen to her. It's basically your parents are telling you to eat your broccoli even though you don't like broccoli, but they know what's best for you, so they're going to make that decision for you. Basically, with that, the paternalistic model, you don't get to make your own decision. You just get to agree with what the doctor says. Now, this is beneficial for if, say you're in a life-changing car accident, you're unconscious, and the doctor's like, okay, well, we need to give them this medication so that they can wake up. That would be important. But for everyday decisions on anxiety medications, depression medications, anything like that, you should make that decision. This model focuses on a patient's health. It denies any sort of autonomy you thought you had. So this model isn't really used in the healthcare we have now. Now we focus on autonomy, and we want you to make a decision based on what's given to you. Stick with me, TikTok, and remember to like this video. So now we're going to talk about the deliberative model. So the deliberative model is basically where the patient and the physician are going to work on a scenario together based on your morals, and they can include their morals a little bit if they match. Same with this one, I know we don't like listening to authority, but the doctor's not going to tell you what to do. Basically, the doctor is going to give you treatment options or a decision. We're going to talk through it with your ethics and your morals. You have all the autonomy. You get to make the decision, but the doctor is going to sit there and talk to you about it. The doctor will put in their input. They'll explain to you what they think is best, what they would personally do, what they think is right, what they think is wrong. They can persuade you, but they can't tell you yes or no, or give you an option and say, you have to do this. Now, this model, ultimately, you get to make the decision, but it's about growing your morals, understanding, and having that respect for yourself, and the doctor having respect for the patient. So in summary, there's the paternalistic model where the doctor just tells you what to do, like your parents. And there's a deliberative model where basically the doctor tells you can do this, gives you some options, and ultimately you get to decide. Most physicians nowadays use the deliberative model because it allows them to use their medical expertise and provides you with some. It allows you to change your morals or beliefs or hold on to those and create firmer morals or beliefs. So, I mean, it's a good thing medicine isn't just about fixing people. It's about creating your own beliefs, believing in those beliefs, and maybe changing them every now and then. You don't have to do it all the time. So if you're watching this video, you came across it while you're bed rotting, go ahead and give it a like, give it a comment, and follow if you haven't already. Thanks, guys.